Okay, so the next important topic of pediatrics is Duchenne muscular dystrophy. Now, what are the important points of DMD that you need to know regarding short essay question or short answer questions? So, in a child of DMD, the clinical picture will present with waddling, lordotic gait. There will be calf hypertrophy. There will be weakness in the limb girdles, like lower girdle, like the pelvic girdle, will be affected more than the upper girdle, and due to this, there will be a like specific Gover sign, that is pathognomic for Duchenne muscular dystrophy, Gover sign. And then there will be sparing of facial, extraocular, bulbar muscles, and the family history will be positive for the disease, and DMD is a X-linked recessive inheritance pattern. Okay, so it has a waddling, lordotic gait, calf hypertrophy, weakness in the limb girdles, and the lower girdle is affected more than the upper girdle. Sparing of the facial, extraocular, and bulbar muscles, family history will be positive, and it is a X-linked recessive disease. Now, what are the important history points that you need to keep in mind in case of a child with Duchenne muscular dystrophy? Number one, we will ask about the onset of symptoms, muscle wasting, difficulty walking, learning disabilities, and frequent falls and trouble climbing stairs. So these will be the positive findings in a child with DMD. These will be the presenting symptoms of DMD. So on examination, what you're going to be finding is that there will be calf muscles pseudo hypertrophy, and the muscles will be weak in front of the leg, and due to which there will be foot drop, and the child will be walking on toes. So pseudo hypertrophy of calf muscles, weak muscle on front of leg leading to foot drop, and child will be walking on toes. Examination of the curvature of spine will show us scoliosis, and cardiovascular system will show cardiomegaly, and respiratory system will show respiratory failure. So calf muscle examination will do, and will examine the spine as well as CVS and respiratory system. So what are the important lab investigations that you need to carry out in a child with DMD, or in a child in which we are suspecting DMD? Number one, the plasma creatine kinase level will be increased, and the plasma CK level is a screening test. Okay, then we'll do a muscle biopsy, which will show the decreased level of dystrophin protein, and it is diagnostic. Then we'll do an electromyography, and we'll do PCR for dystrophin gene mutation, and other tests include ECG, echo, and chest X-ray for associated findings. Okay, so plasma creatine kinase level, muscle biopsy, EMG, PCR for dystrophin gene mutation, and other examination. These are the important clinical or lab investigations. Now, what are the possible treatment options of DMD? Number one, that there is no curative medical treatment available. The main treatment is to treat the complications and to improve the quality of life of the child, and the possible supportive therapies include physiotherapy, appropriate seating for the child, steroid, for example prednisolone, digoxin for cardiac issues, treatment of pulmonary infections, and avoid contact and immunization, because he will be at increased risk of developing the disease from any contact. So immunization should be done at time. Adequate hydration and nutrition should be provided, for example calcium supplementation and a balanced diet. So physiotherapy, appropriate seating, steroids, digoxin for cardiac issues, treatment of pulmonary infections, and adequate hydration and nutrition support. So these are the proper you can say possible treatment options, but there is no cure for the disease. There is no medical treatment, there is only supportive management. So yeah, these were some of the important points, clinical features, history, examination points, and investigations which you can do in a child of DMD or Duchenne muscular dystrophy.